Hello, I'm Susan Sanderson. I'm the Executive Director of the Realistic Success Recovery Society. We've been operating since 2007 in Surrey, British Columbia. So we operate 3 facilities for addiction from alcohol and drugs for men. They are registered under the Assisted Living Registry Act of British Columbia. This facility that we're in the backyard was the first facility in 2013 to be registered under the new ALR registration, which we're really proud of. And so we help people develop skills, daily living skills, get their ID back. We do addiction counseling, both group addiction counseling and one-on-one with 2 professional counselors. We participate in AA and the 12 steps, and we have an intensive 12-step study group that our residents are encouraged to participate in. With COVID, they attend AA meetings via Zoom, but normally we do those in person. And then we also supplement it with what we call rehabilitation through recreation, which involves bowling, having group in the park, going to the lakes when we can, and any other kind of recreational activities that we can do or that we can afford given our budget. Some years we've gone fishing. In the past we were able to do some camping, and in those situations they do group by the campfire, which was very instrumental to a number of the clients in 2012. So in applying for grants, we're looking for something that we do that is a project, and so under Reaching Home, which is a 2-year grant, which SurreyCares participated in as a partner with us on, which we're really grateful for. The project is called Recovery Works Outreach, and it involves our outreach folks talking to men who are incarcerated, who are interested in coming into recovery either as part of their sentence or when they're finished their sentence. And because of COVID, they need to be COVID-free and often are staying for their whole sentence, which means that our outreach staff spends weekly visits with them on the phone and talking to them and building trust, going over again and again what the expectations of our program are, what we expect from them, what we offer them. And so by the time they're released to us, the goal is that they are more receptive to recovery. They have a better understanding of what to expect from our program and what we offer, and therefore their chances of success are much higher. And so far, even though the project's only 6 months old, that is working. So we're really pleased about that. Most of the folks who are incarcerated have lost all their ID. So in order to get any basic services, you need ID. You can't go to the dentist, you can't get your medications, you can't do anything without your ID. So we spend a lot of time working on how to fast track that, helping them do those things. And then from there, once the ID, then there's bank accounts and all the other things that flow from that. After 120 days, they are able to start planning for work or school or those kinds of opportunities. Either return to an industry. We have a number of our alumni, or now who are alumni, residents who went through Kwantlen and the trades program. Didn't know what they wanted to do, had been working before they came here but didn't want to go back to whatever they were doing. So they're now apprenticed through unions and working and being paid a really good living wage, buying new cars and living independently, which is really a blessing. So the first grant we received from SurreyCares Foundation 3 months ago helped to support our outreach folks and helped to get them out on the street and to support the salaries of those people. We did a lot of overtime. We did many weekends that were not expected because, of course, addiction doesn't have any hours, and usually mornings are not the time when folks who are in addiction reach out. So it's it's later in the afternoon, it's on the weekends, it's at night. So we've been able, that grant was able to support overtime hours for our outreach folks, which we're really happy about. The Realistic Success Recovery Society is extremely grateful for the Smart and Caring Community Fund, SurreyCares, and all the donors who support community organizations such as this, who then donate to other service providers who are working with folks on the street and on the ground and changing our community. It's really, really important to understand, I think, that the folks that we serve all come from families with addiction and alcohol problems. And nearly every one of them was homeless before they came here. And so we are providing support for those folks that cannot do it on their own. The basic revenue that we receive for support recovery for 16 years was $30.90. Our actual costs are at least $40 a day, and for some service providers, it's $60 a day. We were able to receive an increase last year to $35.90. So we're getting there, but we're still a long way away from where we should be. I'm advocating with the new minister to have it increased to $35 this year. The Ministry of Mental Health and Addiction have also, for the first time in the history of BC, put out a grant for evidence-based or bed-based expansion for both licensed and regulated supportive recovery, which we're really grateful for. So it's extremely important for us to be recognized by SurreyCares and for us to recognize SurreyCares' smart and caring community donations. So thank you very much.